like to let Bridget answer a question for us. And again, Bridget serves as the President and CEO of the Healthcare Foundation of Greater Kansas City, among other things. Bridget, you did operate a safety net clinic before taking over the reins of the Healthcare Foundation. Can you speak about your experience in working with Medicaid patients and how the program affects them?
Of course, I lived in fear after Jackie's comments that I would be the one to fall and hurt my hip. Good morning. It is my absolute privilege to be here. I am an Independence girl, so it makes my heart swell with pride to think of my hometown as the intersection of history and health, and to, of course, drag my poor children here to be witness to that. So I've been thinking back on my many years of being a practicing physician here in Independence, and I have had the privilege of taking care of many people who have had government-sponsored health insurance, many of whom are here in the audience, and also that special responsibility of taking care of those people who have no health insurance. And so it is that perspective that has shaped me. And Mr. Truman was also shaped by his experiences. And you heard talk of the Poor Farm. Well, when Mr. Truman was actually the Jackson County judge, it was his responsibility to be the administrator of the Poor Farm. And he recognized the burden that that put on families who were faced with illness that changed their ability to work and pay for their medical services. And you heard his grandson talk about the effects of World War II and the number of people who were actually fit for service. And 1/3 of the people who came forward for service in the Army were turned away because of malnutrition and because of treatable medical illnesses. I think he said it well when he said the right to adequate medical care and the opportunity to achieve and enjoy good health were his goals. The fact that President Johnson came here 20 years after that work began just lets you know how much effort and diligence and patience it takes to get historic legislation passed. That's just the passing of the legislation. What happens on the back end is how do you make it work? The story that I especially appreciate is that the physicians wanted no part of Medicare. They thought that having the government involved in payment was a complete disaster and that people were better off if they just paid their own bills directly. You know how much medicine costs these days. You can't imagine that we could be in that space. Well, President Johnson was not bothered by the AMA. He was a very thoughtful fellow. And so he invited the president of the AMA to come to the cabinet room and visit with him. And so the president came with his staff, and the president of the AMA came with his staff, and they sat down and they talked about Vietnam and about the need for medical services for people who were injured in battle. And President Johnson asked the physicians, are you willing to stand with me and help provide that care to these people who are injured in battle? And the AMA said, absolutely, we will make sure that that happens. President Johnson said, fantastic, let's call the press. In come the press, President Johnson makes a speech, and I will paraphrase, but he basically says, these wonderful physicians have stood up to take care of these people who were wounded in battle, and we owe them a debt of gratitude. The first question he got from the press corps was, that's all well and good, but are they going to take Medicare? President Johnson said, I just told you that these people were patriots and that they were serving our country. Medicare is the law of the land. You know that they will uphold the law. Isn't that true? And the AMA president said, of course not. So there's a lot of savvy wheeling and dealings that get these things to the point where they actually work. Now, these men created Medicaid as a state and federal partnership. The majority of the funds come from the federal government, but each state runs its own program and tailors it to the needs of the people who live in that state. So when Medicaid was born, it was really just an outline of a great idea. And the meat was put on the bones over the following 5 decades. Each state's invited to propose how they think that it would be best to serve the people of that state. there are actually 300 special arrangements between the federal government and the states to tailor those programs, 18 just in Kansas and Missouri, so that we can adapt Medicaid to serve the people who live here the best. And over those 50 years, it also evolved from being part of the welfare system to truly being a standalone health insurance delivery model, and has evolved to be a much more sophisticated and accountable system in those 50 years. But Medicaid is not just a funding arrangement. It is fundamentally a way that we take care of the vulnerable and those who are left behind by our traditional health insurance system. And I know I don't have to clarify in this room the difference between Medicare and Medicaid, but I think it is always helpful to remember how those were designed. And for my children who should be able to repeat this by now, that Medicare is the way that we care for our seniors, and that Medicaid is the aid that we give to people in need. And in Missouri and Kansas, Medicaid is set up as what we call a categorical system. So it's not enough to be poor to qualify for Medicaid. You must be poor and. You must be poor and pregnant, poor and disabled, poor and elderly, poor and a parent, and most of all, poor and child. You may remember that Bible story about feeding the 5,000. The part of that story that always struck me the most was the phrase, "not counting women and children." Medicaid is where we count the women and children. Children are often the silent beneficiaries of Medicaid. And right now there are more than 30 million children who benefit from Medicaid and the CHIP program. And starting only as recently as the 1980s, we began covering pregnant women. And now Medicaid covers half of all the pregnant women and their babies in the United States. This was an extremely wise investment, because we know that providing early care in pregnancy and early care of children means that kids start off on the right foot. And we've made a concerted effort to get kids who qualify enrolled in Medicaid. And that means that we have cut the number of uninsured kids in half. But even in America, 7% of children remain uninsured. And we can do better than that. But having coverage is only part of the story. There is growing evidence that children who have access to Medicaid live in better health, have more family stability, and have higher future incomes than the children who are left behind. So it is more than just access to care. Medicaid and Medicare stepped in when there were people who had no other options. Those people with kidney failure, those who were disabled, those who suffered from cancer and were uninsurable, those with AIDS. And it has meant that AIDS is no longer a death sentence, that dialysis is available to people who want to continue to work, that parents are healthy in body and mind to be supportive of their families, and that children who have access to dental care and vaccines and preventive services are able to reach their full potential. Sometimes overlooked in Medicaid, we forget that there are vital services in there to low-income seniors. And right now, 20% of all Medicare beneficiaries are actually also on Medicaid because their incomes allow them to qualify. 1.5 million people who currently reside in nursing homes can only afford to do so because Medicaid helps with the bill. And another 3 million seniors are receiving in-home services so they don't have to end up in nursing homes. I told you earlier that I spent most of my career working with those who lived in poverty. And both the patients and I were so delighted and absolutely relieved when the patients qualified for Medicaid coverage and could graduate from having to be seen in free clinic. And it meant that they no longer feared that unexpected catastrophic illness that would be so threatening to their families. My friend Cynthia, who lives about 2 blocks from here, had had several strokes, one of them where she bled into her head. And when she finally was released from the hospital, she was so glad to be declared disabled enough that she could qualify for Medicaid, because it was her desire that she'd be able to take her blood pressure medicine every day. That's a story of success, because Cynthia hasn't had another stroke. That's one story. There's a lot more work to be done. The Affordable Care Act means that all states have been given the opportunity to cover more of those who are socially and economically vulnerable. There's been great progress so that 30 states now have removed the category of poor and now they are serving all of those who meet the qualification of being poor. In this state, we face that historic opportunity. And I know that there will be many who continue to work on behalf of the vulnerable to allow them to benefit from the possibilities of Medicaid. And there will be a time in the United States where your health will not be determined by the state in which you live. So I leave you with these thoughts. These kinds of historic undertakings take time and patience. That there is continual work to be done so that we who are on the forefront of these programs design them carefully and thoughtfully with that person in mind who has to use the program. And that we pledge that when those who come behind us look back at those 50 years, that Mr. Johnson and Mr. Truman will know that we upheld the good work that was done before us. Mr. Truman would be proud that we stand in this library and on his legacy to remind ourselves that we will not be the ones who did not count the women and the children and the disabled and the elderly and those who live in poverty. And that will help to make it true that health is not a privilege for the few, but more importantly, an opportunity for the many.